My mom is scanning the room. Okay.
Come in.
I'm going to shut the door for privacy. I'm going to wash my hand. Hi, I'm Nicole. I'm going to be your nurse today. Can I have you state your name and birthday, please?
Brendan O'Malley, 5/14/91.
Okay, patient appears stated age. Patient is well groomed. Clean hair is brushed. No body odor. No obvious signs of illness. Can you tell me where you are right now?
Nicole,
And what day is it?
the 10th of October.
Patient is alert and oriented ×3. How are you feeling right now?
Feeling well?
Mood matches affect, and speech is clear and coherent. Are you experiencing any pain right now?
No.
And do you have any allergies?
No.
Okay, no allergies. Okay, now the face. Color is appropriate for ethnicity. Warm and dry. No lesions. Eyes are symmetric. I'm going to check your pupils. I'm going to check 2 times. One for your direct light reflex and the second for the consensual. Can I have you watch my forehead, please? Okay. And the other side. Okay. And then follow my pen line. Okay. Pupils are equal, round, reactive to light, and accommodation. I'm going to check your conjunctiva. It is pink on your lower eyelids and white on your sclera. Can I have you open your mouth, please? Hard and soft palate is pink, moist, no lesions, no bleeding. Your teeth are intact and no cavities. Gums are pink, moist, no lesion, no bleeding. Can I have you stick out your tongue? Tongue is pink, moist, no lesions, no bleeding. And can you go ah? Uvula retracts appropriately and is midline, and tonsils are 1+ equal bilaterally. Now can I, full face is symmetric, there is no facial drooping. Can I have you smile, frown, puff out your cheeks, raise your eyebrows. Cranial nerves 5 and 7 are functioning. And check your carotid pulses. Okay. Carotid pulses are equal bilaterally, 2+. I'm going to check with my, I'm going to oscillate for bruise. Okay, go ahead and take a deep breath in and then hold it. I'm checking in 3 spots. Okay, no bruise. Now I'm going to check your upper extremities. Skin color is appropriate for ethnicity, warm and dry, intact, no lesions, and a couple freckles. I'm going to check your brachial pulse, which is 2+ equal bilaterally. I'm going to check your radial pulse, which is 3+ equal bilaterally. I'm going to check your nail beds for capillary refill. Capillary refill is brisk, less than 2 seconds. Can you put your thumbs together? No clubbing. And then can I have you squeeze my fingers, please? Okay. Muscle strength is equal bilaterally. Now I'm going to oscillate your heart sounds. First, I'm going to listen in the aortic, which is second intercostal space right of the sternal border. I'm going to go to left of the sternal border, second intercostal space, which is pulmonic. Erbs, which is third intercostal space, left of the sternal border. Fourth intercostal space, left of the sternal border, is tricuspid. And then mitral area, which is mid-clavicular line, fifth intercostal space. And then I would listen here for the apical pulse for 1 minute. And rate and rhythm is regular. Now I'm going to go backwards and oscillate with my bell for murmurs. I'm going to start at the mitral area, which is mid-clavicular line, fifth intercostal space. Then I'm going to go to tricuspid, which is fourth intercostal space, left of the sternal border. Erbs, which is third intercostal space, left of the sternal border. Pulmonic, which is second intercostal space, left of the sternal border. And then I'm going to go to aortic, which is second intercostal space, right of the sternal border. And there are no murmurs. S2 sounds were loudest at aortic and pulmonic. I could not distinguish between S1 and S2 at the herbs area. And then tricuspid and mitral is where I heard the S1 sounds louder than the S2 sounds. Now I'm going to also take your lung field. And every time I press my stethoscope, can you take a deep breath in and out?
Sure.
Okay. Okay, there's no adventitious sounds. I'm going to do your lateral sides. Same thing. And the other side. Okay, and can I have you stand up so I can use your back? Posterior part of your lungs. Same thing, keep breathing. Okay, no adventitious sounds. Can you please standing still? I'm going to check your costovertebral angle. Let me know if there's any tenderness. Any tenderness?
No.
Okay. Now can I have you step back and then bend forward? I'm going to assess your spine. Can you bend down a little more?
Oh.
Spine is straight and flexible. And then can I have you stand up? And then your anterior posterior diameter is 2 to 1. Okay, go ahead and sit down. My dog. Okay, go ahead and lay down. I'm going to flip your shirt a little bit. Okay. Contour is flat. Skin color is appropriate for ethnicity. No lesions or scars. There are 2 nevi and a couple freckles. The nevi are symmetric. The borders are regular. The colors are consistent. Diameter is less than 1 millimeter, and there is no elevation. I am going to listen in all 4 quadrants for vowel sounds. There are active vowel sounds in each quadrant. If there wasn't, I would listen for 5 minutes in each quadrant. In the right lower quadrant is the cecum and appendix. In the right upper quadrant is the right kidney, the liver, and the gallbladder. The left upper quadrant is the stomach, the spleen, the pancreas, and the left kidney. And then the left lower quadrant is the sigmoid colon. I'm going to now percuss. I heard dullness over organs and tympany over intestines. Now I'm going to palpate, and I'm going to watch his face for facial grimacing, and I'm going to check for muscle guarding and tenderness. Let me know if you feel any pain.
Nope.
Okay. Okay, no tenderness and no pain. As you slowly get up, I'm going to check for your jugular vein distension. No jugular vein distension. Now you can check your lower extremities. Okay. Skin color is appropriate for ethnicity. Skin is warm and dry. No lesions. No abnormal nevi. I'm going to check your popliteal pulse, which is 1+ equal bilaterally. The dorsalis pedis pulse, which is 2+ equal bilaterally. Now the posterior tibial pulse, which is 2+ equal bilaterally. I'm going to check for edema, no pitting edema. I'm going to do the Babinski test. Okay, and on the other side. Babinski test is negative. Can I have you stand up, walk to that wall, please, and then walk back. Stride is even, no assistance needed, independent. And then can I have you stand together, your feet together, arms at your side, close your eyes, and this is Romberg's test, and I would do this for 30 seconds, and it is a negative Romberg's test. So go ahead and sit down. And that's it.